Okay, good afternoon, good evening, everybody. Thank you so much for being here with us. Um, are you a nurse supervisor or manager and you just got this position and you are trying to figure out how to do this job to the best of your ability? Well, that's why we're here today. My name is Maggie. I am a advanced practice registered nurse, and I've been a supervisor, manager, administrator, DON, and I am here to kind of help you acquire some skills to make your job a little bit easier. And tonight, I chose a topic that is really not that difficult or new or strange, but it's just that I know that some people struggle with organization. And as a manager, as a supervisor, that is like a basic skill that you're supposed to learn. So, in my job, in my role right now, I help new nursing supervisors, managers develop skills that are going to take them from, novice to being a highly skilled practitioner, manager. And then the job doesn't become so stressful. What do we call organization? Organization is a process that you use to get things done, whether you organize at home, whether you organize in your job, whether you're volunteering, whether you're doing nonprofit, across the board. Everybody has to learn how to get things done. And some people may choose to get things done by delegating, which is perfectly fine, remembering that you still have responsibility for the task that you delegate to whomever, right? When somebody gets a position and they say, I want you to manage these 60, 80 individuals, and we talked about in a previous class as to what a supervisor is versus a manager or an administrator. The supervisor, you closest to the employees, and your task is to get things done. Okay, you're like giving people their marching orders and say, of course, if we're talking about skilled nursing facilities, we're thinking getting people fed, doing vital signs, nurses doing their meds, their treatments, and of course, as a supervisor, your list becomes longer and longer. So, what I did, I had developed a tool that I'm going to put in the chat and let you, let's see. Right. It's a grid. I call it a grid because, paste. Oh, it didn't go through. When you are a new supervisor. You're trying to figure out, how do I get all this done? And what is all this? And that's what I said. You need to know what your job description says. Have a copy with you and keep it on your clipboard. Certain things that you need. As a nurse, you need a stethoscope, you need a pack of pencils, you need uh, not dry erase, but magic markers, yellow highlighters, and all those things that you need. As a supervisor, you're gonna need like a nice clipboard where you can. I usually, when I was supervising, I had one of those that you kind of close and it kind of, you can clasp it, clip it, not clip it, but it closed really tightly. And inside, you can have multiple stuff. Because as a supervisor, you're going to need to know how to contact people. You need the physician, provider on call numbers. You need your manager, your DON, your administrator, because you need those things at your fingertips so that you can access them, right? I don't think you want to put those on your phone, but you need to have a form, okay? You need also the codes for your facility. You want to have um, the lock unit code, how to get from one unit to another. You need to know how to call the fire department in your area. You need to make sure you document the number for Adult Protective Services or DCF. You need to have phone numbers for, um, let's say, the local police department, even though it may not be 911, but when you call 911, they're going to ask medical or fire or something like that. You need to have those numbers in addition to your staff phone numbers, because when you start getting really tight and you have to call and you have to beg people to come to work, you want to have an employee contact list. Another list that I used to keep with me also is a list of the most common codes that they use. I don't know about you, but when I was supervising, I was responsible for doing all the admissions. Now you need to make sure that the person who's doing the training at your facility really spend some time with you, showing you how to best do an admission, because the worst thing you don't want is that when you home, you out, with your family, and then somebody's calling you saying, well, you didn't do this, you didn't do that. So again, those are skills. This is the responsibility. You want to be sure you know how to do this job to the best of your ability. So make sure you master how to do these admissions. And part of the admission process is make sure you do the ICD-10 coding. So you want to get a list of the most common one, hip replacement, knees and CHF and exacerbation of diabetes, wound, sepsis, some of those basic ones. Understanding that the codes that may have been used in the hospitals are not the one you're going to be using in a post-acute care or in a long-term care facility. Because if somebody had a fall, you can put fall like number 3 and number 4, but the first code, which is the billing code, is going to be um, post, what do they call that, orthopedic aftercare or something like that. So just understanding how that wording works and what is appropriate for the patient in the setting that you're in. Okay. In acute care is whatever it is that they came in with. Okay. So make sure you have all these lists and get yourself a nice clipboard. I went online and I didn't see exactly the one that I'm talking about, and I recently lost mine. And let me tell you, I mean, in that clipboard, I call it clipboard, but like I said, it's like you put the paper, it's got a cover, so it's not really a clipboard. But I had like business cards for certain people. Um, I had my codes cheat sheet. I had all my phone numbers, and I lost it. And I even had anyway. I had something else in there that was really important. And when I lost it, I was like, oh no, oh no, oh no. Okay, so you want to make sure you get that. So another thing, staffing. You don't think you need anything. I don't think you need anything on you about staffing. In addition to just having the staff phone numbers and maybe your staffing coordinator's phone number. That's something that you need to have, right? Because if you're having a really hard time with staffing, you want to be able, you can reach out to her. And it's not the time for you to be scrambling around trying to find what that number is. Make sure you have that ahead of time. And you need to know which provider is on call so that when you need to call, you know who to call. Okay. The other thing you talked about last week, we alluded to this nurse who, in an emergency, did not know what the patient's code status was. So, as a supervisor, make sure that you know what the process is in your facility for establishing what is somebody's code status. Is it something you're going to go on the computer and it's going to be right there? Or is it something that's going to be in the chart? Because one of the exercises we did is like, if somebody is crashing while you with the patient assessing, deciding whether you need to do um, CPR or not, you send somebody, say, you go get the chart. And hopefully in the chart, if somebody is a full code, you're not going to find anything in there. But if they're a DNR, you're going to have that yellow form in that chart. So find out where they put that. Make sure you ask that question. where do you keep your DNR, your patient's code status? Is it in the computer or is it in the chart? Because you don't ever want to get in that situation where you're trying to figure out, right? Another thing I did when I first came on shift when I was a supervisor was I would print a census, the current census. Now, the census that you print from your computer is usually the midnight census, right? So at 12 o'clock, how many patients did they have? And since then, how many people were admitted? How many people discharged? That way you know who you have, where your census is. And it also tells you who the new patients or residents are, because you, as a supervisor, want to spend a little time touching base with that patient, because these people are going to have a little bit of trouble adjusting to a new facility, a new environment, a new place. And if they have dementia, I can guarantee you it's going to be a challenge for the first week or two, because they're transitioning to another different place. And it's possible that in the hospital they were having some behavior issues and they had to be put on antipsychotics. And somebody like me comes in and say no antipsychotics. I know some of the nurses don't like it, but we do have regulations that keeps us from prohibit us from keeping an elderly patient with dementia on Seroquel. Okay, we have to show that we've tried different things, because there seems to be an abundance of people being medicated with antipsychotics for behaviors in long-term care facility. There was a big study that said that. So we come in and we do that, but we're just doing it to keep your facility in compliance. It's not that we don't care what happens. We don't care that they're having behaviors. Hopefully, we as providers are more responsive to your needs, and we are able to medicate that patient so that they don't, challenge you too much. Okay. So when we talk about organizational skills, okay, organization in my mind means it's a way you coordinate things in a way that is efficient. Okay. You want to do things in an efficient way. You don't want to be doing this, and there is no pattern. Then you become frazzled and you can't see how you're progressing. You can't see how you are accomplishing those tasks, those goals. So I have a form, and I thought I was going to be able to put it in the chat, but it's not going. So what we want to do, if you want me to send it to you, I call it the grid. And let me see if I can pull it. In the grid, you put your the day, your shift, and then we start with the census. Okay, it says current census. It names the admissions and the room numbers. It puts the discharges, so you don't have to worry about those. You may have to break down the chart. You may be responsible for taking that patient out of the system, so you need to know if they're discharged or not, because that's going to affect your census as to whether your census is, you know, uh, accurate or not. Okay. And then I have things on there on that form, which I will send to you again if you send me your email and ask for it. It's we have anybody that's a priority. Okay, somebody who is having problems, somebody who's got pending stuff, like somebody had a situation and they did some labs, we're waiting for the labs. So this is where you get all your reporting. You're filling that form as you're getting report. But again, as somebody who is realistic, I'm a realist. I realize that sometimes you don't get report, and we spoke about that on one of these other videos, is that you may not get the information that you need, but you need to find a way to get the information. So you go to whoever you figure knows how to get you accurate census. You go to the different units, you ask the unit managers, you ask the nurses, did you get any admission? What room? You go and you write the names. If you see an empty bed, did so and so go home? Because as you get used to your facility, you'll know If somebody was there yesterday, they were not there today. And did they go to the hospital or did they go home? Because that's going to affect how you close that chart, the reason for that, the patient not being there. And understanding that in facilities, there is a big um, focus on preventing RTH, return to hospital, because your facility is going to be rated as to how many people come into your building and end up going out in the first week or two, because that doesn't look good for the facility. If the hospital discharges someone to you and then they have to go back, it could be it wasn't you doing or not doing something in the facility. As we know, a lot of people get discharged way too early. But again, I talked about that last time. What is it that you can do and what is it that you cannot do? You can only do what you can. What you do is you focus on the things that you can control. And how do you control keeping somebody from going to the hospital? Is by being proactive, by anticipating and acting quickly if they start to go south, right? So if a patient starts showing signs of whatever, decompensation, their blood pressure starts going down, the heart rate's going up, they have a low grade fever, and look, use your assessment, your visual. How do they look to you? What is their mental status? Do they answer to you? Is it a change from what you know this person to be? And ask your CNAs, how is that person? Let me tell you, I cannot begin to impress upon you how important it is for you to develop a good professional relationship with your CNAs, whether you're a supervisor, whether you're a nurse or a manager. Because these ladies and gentlemen, they are close to the patient. They see them every day. And if your CNA comes to you and say, you need to come and check on Miss So and so, go check on Miss So and so, because 9 times out of 10, there is something wrong with that patient. And can you act quickly? Because in your mind, as a supervisor, that's part of your job to try to keep those people from going in the hospital. Okay? So, organization, get your stuff in order, get the information you need. How is everybody doing? Who is in trouble? Who did you call the doctor on? If somebody, close to coding, and that's where we go into the prioritizing, right? So when you come on the floor, you may have your marching orders like, I want to do 1, 2, 3, 4, but you may not be able to do 1, 2, 3, 4 because you have to go see that patient who's not doing very well. That's prioritizing, right? Calling the labs to check on somebody else, returning a phone call from a family member, those can wait till later. Okay. When you get on, you make sure that your patients are okay. If anybody is not doing well, this is where you drop everything and you go. You do what you need to do. You draw the lab, you call the family, you order a stat chest x-ray, whatever you need to do to stabilize that patient, and you jump in there with that nurse. And also at the same time, you're creating that camaraderie and that relationship. You're strengthening that relationship with that nurse, telling her, I got you. You're not here by yourself. We're in this together. Okay. Instead of telling the nurse, well, why don't you call the doctor? Do this, do that. Go with them. Okay. I always love to assess my patient with the nurse. Okay. She's doing vitals. I'm listening to heart and lungs. I'm looking at the legs. I'm checking for edema. I'm talking to them. I'm assessing their level of consciousness. I'm looking at color, temperature. You know, you know, as nurses, this is why you have to be a strong clinician. I feel that it's important. Now, we do have certain models of care deliveries where they don't. I work in a system where at some point they had this patient focused model that, anyway, I don't need to go into all that, but what I meant was that they did not feel that you needed to be a nurse to manage a unit. And I'm not saying that you must be a nurse, but you must have been around nursing and understanding what our job is in order for you to manage us, right? But as a supervisor, of course, you have to be a nurse. As a unit manager, you have to be a nurse. But that model of care didn't, they just went way left on that. And anyway, I don't know how successful that was, because it was a whole different way of practicing that. As you guys know, every time something is new, it just keeps adding onto the nurse's, list of things she's responsible for. So organizational skill, a skill, the word skill entails that is something that you're learning, okay? It may not be something that you are born with or are comfortable with, okay? A skill is something you develop over time by practicing over and over. For example, active listening, that's a skill. Some people may be born good listeners. I wasn't. Okay. I have a very short attention span. If somebody's talking to me, you got my attention for the first 20, 30 seconds. After that, it takes work for me to remain focused on what you are saying, what you are talking to me about. If it doesn't register that it's something interesting or something of value, of interest to me, my mind starts drifting. So I have to make myself look at you doing the thing that you've learned in those classes, listening, nodding, reflecting. Oh, really? Oh, wow. It keeps you engaged. You have to keep doing that, because if you don't, you're going to go off. I know for me, they're going to lose me. If I don't actively do those things, I'm gone. Okay. So the skill of being organized is something that you have to practice. And first, get that clipboard that I talked to you about, get all the information that you think you need, all the phone numbers, any kind of protocols that you think might be important to you. Like something I would want to put down in my little toolkit, I could call it that, is how do you manage an elopement or an attempted elopement? If somebody, person with dementia, because all these emergency doors, even though they may have codes or whatever, if they push on it long enough, it's gonna go. And I've had patients go, right? So how do you handle it? You need to find out. So you want to sit down with your manager and say, what do you want me to do if this happens? If there is a patient to patient incident, how do you handle that? Write it down. If you're not part of that unit and you have not experienced those things, this is part of your being organized to know, oh, steps 1, 2, 3. That's what I do if this happens. Now, for example, I can tell you, when I had a resident who tried to get out. So what you want to do, bring that patient back, you assess that patient, do vital signs. Skin check is big in long-term care, so we're all doing skin check all over the place. Then you might want to do some neuro checks, find out how disoriented or that they are, because there might be a medical reason for them to be acting out, right? To want to escape. Sometimes somebody is anxious and they automatically think, I'm going to go home, and that's why they exit the building. Then you have to call the doctor and report it. You have to call the family member and report it, and it's not always a nice call, because family members expect that you're going to be looking at their loved one 24/7 and your eyes going to be on them. I don't know why they think we have that much time, but that's what they expect. And then it's sometimes, as a supervisor, I have to sit them down and say, I'm sorry, but we don't have that level of care in this building where we can have our eye on a patient 24/7. So if your loved one is at such a risk of elopement, you might want to consider hiring a sitter to watch that person. And I think sometimes we, as supervisors, and we talk about, no, I didn't talk about it. I wrote something about assertiveness this week, But sometimes we have difficulty talking to family members like that. It's like we are scared. And that's another skill. Maybe I do this one next week. How do you practice becoming assertive? Assertive means knowing how to get your point across without being angry or unprofessional, standing your ground, demanding respect, commending respect with your demeanor, how you carry yourself, how you dress, how you talk to somebody, how you approach them. Okay? You don't want to be a pushover, but you need to make sure you can get your point across. So telling a family member that, you may have to consider, and when they say, sometimes they'll say to me, well, who do you recommend? Careful. You don't want to recommend anybody. You could say, well, I've heard of this company, that company, give them two or three options. See, I'm not recommending any of them, but I've just heard their names. You may want to call and talk to them. Because again, we had something on legalities last week. You got to make sure you are not saying anything that's going to be compromising for you, because understand too, kind of away from organization, that there is this perception in long-term care from the public, with everything that's been happening with negative publicity. And it's true that some residents have been mistreated in some facilities, but hopefully it's not in your facilities. That's why you have to do everything you can to the best of your ability to keep that from happening. But there is this perception when a family member puts their loved one in a facility, they expect that 5-star level of care. As I said again, that the corporations, the hospital, the owners, all the materials, and when the person who is your admission person in the facility, you know how they sell your facility as being this utopia like place where we have, angels, floating around, and somebody at their beck and call, 24/7, and they come to your facility, and then there's like one nurse for 30 patients and two CNAs, and then they don't understand why somebody is not washing my father and changing his diaper even before it's wet and doing all these things. It's very unrealistic, but this is what we have to deal with. So your job as a supervisor is not to kind of take the scale off their eyes, but you want to give them a reality check in a nice way. It's, again, it's a skill. So if you see a family member every single day, you want to develop that rapport and trust by talking to them, attending to their loved one, being calm and kind goes a long way. Okay. But what you don't want to do is tell them, well, I'm the only nurse here for 50 patients. And I hear nurses say that all the time. Don't do that. Because let me tell you why. They don't care. When a family member, and the patients themselves are going to be very quick to tell you, well, I'm not here for free. The government is paying your salary. I am paying your salary. My insurance is paying your salary. Don't tell me you haven't heard that before, because they will tell you. They will tell you. So, again, the skills of being able to talk to someone, get your point across, make sure you can stand your ground, and make sure you're doing everything you need to do in your professional judgment to keep your patients safe will go a long way. So, let's go back to organization. So, you come on your shift, you get all your little protocols and other protocols you may want to talk to your manager about, because when you first get a job, I'm just coming from a point that you haven't worked in that facility and you don't know how things are done. Now, if you've worked in that facility and you were promoted from within, you way ahead of the curve, right? You already know what to do. But if you don't, if you're coming into a new place, and a lot of time that's the way it is, you need to ask, What is your protocol for this? What is your protocol for that? Another protocol would be, what if somebody is crashing? Now, I know a lot of time some people would say their managers, their managers don't want them to send people to the hospital. I've heard that a lot, right? Now, we can't um, hide behind that and say, well, my manager didn't want me to send somebody to the hospital. I keep telling you guys, it's going to be your license, right? You cannot go to court and say, well, my DON said, and we spoke about that last week when we talked about legal risks. It's what you do as a professional that you're going to be judged on. Okay, you are not going to be judged on what your manager said. You're going to be judged on what is it that you did as a supervisor, as a professional, and that's why those nurses got hung up. Okay. So, if you, as a supervisor, you assess a patient with your nurse, right, and you deem that patient to be unstable. Now, sometimes I don't wait to call a physician to send somebody out, okay? Because if somebody is crashing, I'm calling 911 and then I have somebody call the doctor at the same time. They say, I'm sending somebody out because A, B, C, D. Okay. You don't want to say, but the doctor didn't want me to. Again, your legal responsibility. Understand that this patient's life or whatever is based on your assessment and your actions. Don't think saying the doctor, or what if you can't reach a doctor? What are you going to do? Hold the patient until you can talk to a doctor? Mm-mm. No, ma'am. No. Okay. So get your protocols from your manager, but still understand that your judgment goes first. Okay. This is what's most important. So you want to get all your information about when you're coming on, what's going on in the facility. Okay. You know what's happening with staffing by now, whether you're short, whether you have somebody float. Being organized also means that you are taking the lead. You are the leader. Okay. If somebody needs to float, they need to hear it from you. This is a task you don't want to delegate to your lead CNA, because those other CNAs are going to eat that CNA. They're going to be frothing at the mouth, just being mean, and you say, "Oh no, mm-mm. This is why," and you remain calm. And chances are that CNA's or nurse is going to be unhappy because nobody wants to move to go to another unit. We know that. Very few of them would say, "Oh, I don't care." Agency people don't care where they go because they understand, you know, that's how it works. But maybe not, the regular staff. So you explain to them nicely, calmly, and you stay firm. I gave you an example in another presentation as to how I handle a couple of CNAs who are like, "We're not going." Okay, let's see. You got to be strong, and then you don't do it in a manner where you're showing that you're mad or their being mad is upsetting you. No, don't let that upset you. You're doing your job. You stay calm, you stay kind, but you stay firm. Okay? So you got your staffing situated, you know your census, you know who your new people are. New patients require you to go and introduce yourself and welcoming them to the unit, telling them that you're gonna be here for the next few hours, and if they need anything, you make sure they have their call light, make sure they're comfortable. Okay, it's part of transitioning them, and if they feel safe then they're going to have less anxiety and less risk of falling out of that bed and upsetting everybody else. Okay? So you want to make sure you make eye contact, introducing yourself, all your new patients. Okay? And if as a family member there, chances are they would be do the same thing. Answer their question. Is there anything I can answer for you? I'm here. This is how we do this. Just give him a little rundown on how things are done. Okay? Again, we talked about number three, that if you have anybody who is in trouble, those are the people you go see first, even before you go see your new patients. Because again, prioritizing, you want to make sure you stabilize that patient. The lab's ordered, the x-rays ordered, the family is called, the physician's been called, you got your orders, right? Okay. And what else do we have in this on this form? And I'm just still trying to get it. We also have anything that's pending. Okay. You could say, did anybody have any trouble this morning? Oh, yeah, so and so had a fall today. And because then you're going to have to follow up with the 72-hour post fall monitoring. Are we doing neuro checks, and where are they in the neuro checks cycle? And you go see them too. If somebody had an issue the previous shift, you need to see what is happening. That's why if there was a supervisor for the previous shift, it kind of helps to do the walking shift. But if you're supervisor for a whole house, that's probably not possible. But the nurses, you should encourage them to do walking report, where they walk in and they see the patient for what is going on, and not taking the previous shift's word for it. If I were a nurse, that's what I would do. So, okay. Any falls, any other incident, any elopement, any problem with a particular family member, okay? Because you don't want to walk on your shift and be blindsided and no one told you that this person has been a jerk all day and they've been pestering the staff and demanding this, demanding that. You want to be in the loop as to what's going on. That is part of your organization to either follow up, right? Or call and find out, or rectify, apologize, whatever you need to do. Okay. The other thing that you may want to do is, do they have anything that they want to delegate for you to do? Any kind of report that your manager has delegated to you, like you want to make sure your wound checks, how many you are due, because that's again part of your duty as a supervisor to make sure those things are done. So your post-fall monitoring, your wound care, your quarterly assessments, and I know most of the time they're done on 11 to 7, but what if something is like 2 3 weeks old and you know the patient and you have some time, you might go ahead and do it. You may even make some brownie points if you do that, because understand that you're a team. If you can do anything to make your unit look good, it will reflect on you. And don't get so caught up on it's not my job, not my job, not my job. If you have time, be a team player. What you don't want to do is somebody dumping all their work onto you. Then you become a pushover and they take advantage of you. And that is not being assertive. Okay? Organization is making sure that whatever is happening with your nurses, um, in terms of follow up, if a patient had an incident, make sure that that nurse had called the physician and that it's documented, and whatever orders they receive from the physician is also documented. Because what you want to prevent is having people calling you back saying, you need to correct this, you need to correct that. You don't want to do that. Do it right the first time. And as part of being an organized supervisor is to make sure you mentoring your nurses and what to do. One thing I talked about the other day is, how do we manage those pesky EMS personnel when they come to your facility and then they're treating your nurses like they're totally stupid and they're asking the stupidest question. That's why I always tell the nurses, if your patient is crashing, call me. I'll run to your room with you to the patient's room. We assess the patient together. Together, we decide this is what we're thinking is going on and what are the interventions together, right? So you'll be sitting there at the desk with that nurse, getting things done, the documentation, the doctor is being called, the family is called. So if she's calling the doctor, you're calling the family. It's a team effort, right? Again, you're building confidence, rapport, trust with your nurse because she knows you got her back. So if that patient is an EMS call, you've determined that this patient needs to go, they're a full code. So make sure you delegate some tasks to someone. You copy whatever needs to be copied to be sent to the hospital. Remember, you have that non-Medicare form you have to fill out. You got report that needs to be called, so you can be calling the doctor or the family while the nurse is calling report to the facility. But when well, actually, they don't do that until they know where the patient is going, right? So EMS walks onto the unit. I usually say, if the nurse is uncomfortable about talking to EMS, I say, let me handle it. So I say, usually there is the leader who is the um, what do they call them? The person who comes who is the leader of the pack. I call him the leader of the pack. And he comes and he's asking questions and he says, what happened? So usually I would let the nurse, because that's her patient. I say, you tell him what happened. I'm standing right there. And I'm like, yeah. And we assess the patient, we determine this and that, and the patient needs to go. Because what usually happens, if there is no supervisor there or somebody in authority, sometimes the CMS will say, did you really check this? Did you check the blood sugar? Did you do that? Well, I make sure we did all that, okay? Because you don't want them to make you feel like you stupid, that you didn't know what to do before you call them to take that patient out, okay? So you, again, your presence. When they see you, they know this woman knows what she's talking about. I don't want to waste my time messing with her because I command that kind of presence. And I'm no nonsense. I'm not going to be sitting here for you to ask me, did you do the blood sugar? And you already told them in report. So you way ahead of him so that he cannot. And, I've never had a female do that. Anyway. It's usually the males. There was this little guy where I used to work in my area. Whenever he walks on, I'm like, oh boy, there he goes. Okay, because he was always condescending and acting like, he's God. And I'm like, please. Okay. All right. So that's organization, helping your nurses be organized, and you got boom, 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 get this done, and make sure everything is done while you're there on the unit, so that you write the transfer order in the system, and you move the medication. Whatever you need to do in your system, you do it. Boom. You don't have to go back to it. Organization tip number 4 is handle your thing once. Don't put it off. If you need something done, do it. Because if you forget, you may not have time to go back to it. So with your transfer, make sure everything is done. The order is written, the meds are put on hold, the chart is copied, chart is put in the space where it needs to go. Boom, boom. Okay? And anything you needed to send with the patient to the hospital, everything is documented, teeth and hearing aids and glasses. Be careful because those are going to come back to you. Okay? All right. Let's see what else we need to do to be organized. What I do as a last point is, I've seen my new patients. I round on every patient. I still see everybody and say, hello, I'm here. I don't round only once. I make myself get up every so often, and because I have a little spot where I used to sit, so I get off of there, and I'm not sitting there all the time. I have seen people sit in one spot for the whole 8 hours. That is not supervising. You are not modeling for your staff. You need to be out there talking to the resident, talking to your CNA, helping out, lending a hand, answering some lights. Interacting with the residents, that is going to tone down the temperature. If they can see somebody who's a supervisor come in, talk to them. Let me tell you, spending 2 minutes with a resident can prevent a fall, can prevent a concern, a complaint, because you spend that 2 minutes just to be present. Okay? It's important. Understand that. So get up and go around, make more, go around and round. Okay? You want to round on your patient. You want to keep an eye on your CNAs. Most of the time, you're going to have one or two that stress you, that don't follow the rules. They take extra breaks. They take extra long lunches. They're nowhere to be found. They're on their phone a lot. If they talk to the resident a certain way that is not really unkind, you want to find a way to take them aside and do a little mentoring and say, I was passing by and I kind of heard your interaction, Mrs. So and so. I think it might be a little easier if you handle him this way because, he's a little bit sensitive. He just got here and he's trying to get used to us. You know what I mean? And then let them see how you talk to the resident. You modeling. Modeling is just so important, you guys. I can't even emphasize it enough. Okay? Um, so make sure you round often, lend a hand, help, support your nurses, find out what's going on. And then you also have to look at the next shift coming on. What does the staffing looks like? If you need to call some people in, don't wait till 10 o'clock to call somebody to come in at 11. It's not going to happen. So look at staffing for the next shift early in your shift, okay? So that if you need to call that staffing coordinator and say, they only have two, and usually they will, if it's off hours, if it's not during the day, they expect you to call somebody to come in, right? And if we're living in these days in terms of agency or asking somebody to stay over, then you do that. But don't delay it. Don't wait till the last minute. Another thing you need to do to stay organized, if there were any complaints, any concern, you need to follow up on those, right? And see, you may go to the patient and say, "Hi, Mrs. Smith. I heard that you had some concerns yesterday, and hopefully we've resolved it. Did everything happen to your satisfaction? Are we okay?" Right? That again tells that patient that you care. This is a facility that follows through and that you're really concerned about his concern. Okay? You cannot be responsible for what happened on the previous shift or yesterday. You could say to yourself, "Well, I wasn't here when it happened," but yes, it can affect your shift, how he's going to act and behave. So it pays for you to go back and say, "I understand you had some concern. Has anything been resolved to your satisfaction?" That is showing professionalism, right? And that's part of building that confidence and that assertiveness and creating and building trust between you and that patient. I told a story about coming on shift, and one patient said, "You on today?" I'm like, "Yeah." He said, "Oh, I'm glad because we feel safe when you're here." And I said that was the highest compliment that he could have given me, feeling safe when I'm there because I follow through. I go around. I know what's going on. If anything you need to address, you address it. That doesn't mean you address every little thing. But if in your mind you think that something might have the potential to create problem for that patient, you want to address it, okay? And again, as it's not even being organized, but that's part of creating community and building trust in your team. Do the things that you know are going to make your team feel good. Maybe you go out and you bring one of them something extra just to say thank you, and go around and talk to your team. And like I said, answer some lights. Do you need some help? I'll help you move, Mrs. So and so. Okay. I think this one probably needs some water. Let me go get some water. You go do it instead of asking the CNA to do it. Okay. So organization, get your clipboard, get your census, know your new patient, your discharges, address everything that is a patient who is unstable, anything that needs your immediate attention, know how to prioritize. Who do you see first? What do you handle first? You want to be accountable and responsible for those tasks that have been delegated to you in terms of skin checks, and reports, completing admissions, readmissions, making sure discharge is complete or your transfers are complete. Let's see, what else did I used to do that, um, you know, again, I used to get into this issue with the nurses if they had someone who had like skin checks that were overdue when I would ask them to do it. Well, it's not, I was in there. I'd go check that patient and fill that out because I'm a team player. You are a team player. So that patient is on your team. There is something I can do, I do it. Okay. So, and the last thing you may want to consider doing as part of being very organized is to make sure you're passing on report to the next shift. Okay. You don't want to not let the higher up know what's going on because that's why you're there. If somebody had a fall, so I have a report sheet also that I developed that you're going to say on my shift, we admitted these people, this person went home, this person went to the hospital, this person had a fall. So you have an incident portion for fall, elopement. I've had visitors fall. So that's part of asking what is the protocol? Make sure you write it down. What do you do if a visitor comes to visit and they slip and fall? The other thing too, I forgot to mention, you need to find out that's part of all your protocol that you're going to document and put in your clipboard is what if you have an employee incident? Employees stick themselves with a needle, which they shouldn't do, but if they're trying to recap an insulin syringe and they stick themselves, how do you handle it? Do you know where the paperwork is? Do you know where the urine collection sets are? That used to be a big issue for me. We could never find it. And find out all the paperwork you need to fill out. If you need to send that CNA or that nurse to an urgent care, where do you go? They usually have a book. Find out what that book is and familiarize yourself with that because that's part of your duty. You can't delegate that. So make sure you put that in your report if you had an incident. Now, if I'm sending somebody to the hospital, I'm calling somebody and let them know. This is not going to be just a report. I could just text or email and say, this happened, this is what we did, because facilities don't want employees to fall because it could be a workers' comp claim and they see dollar signs going out and everybody goes into an uproar. So make sure you know how to handle that. Okay. Any attempted elopement, you want to make sure that's documented. Um, Anybody who's been unstable that you had to get x-rays on, labs on, anything like that. Okay, if you did those interventions and you ended up having to keep that patient in the building, then they need to know so that the next shift can follow up and make sure they follow through and keep working on that patient. Okay, so I hope those tips help you understanding that being organized is a skill. It takes practice. Some people, even, you can go to somebody's house, you can tell whether they're organized or not because, everything is all over the place. But you got some other people who are so organized, it's like OCD. I'm not I'm not saying you need to be that bad, but you need to have a level of I follow through. I complete tasks, right? So I love it. I'm a list person. And I know you may be a millennial. Millennials are on their computers. That's fine. Just have a way to document. This is what I need to do 1, 2, 3, 4, 5 for my shift, and then go done, 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 done. To me, there is nothing more satisfying than just crossing something off my list, even though you create a new list every time you come. But make sure that those tasks are done and that everything is good with your team, everybody's behaving, Everybody's talking to each other. The patients are safe. Don't be afraid to address something with a nurse or CNA. Don't let things fester. Don't overlook things because it's going to come back to you. All these CNAs are working under your license. Understand that. Just because they're taking care of those patients, they're your responsibility, whether you understand that or not. Okay? So be careful. Keep your eyes open, round, talk to people, talk to the resident, talk to your nurses, talk to your CNAs, lend a hand, and make sure you get your work done. Sometimes you may have to stay after the shift to finish your work, which is fine because you're responsible. You cannot delegate the responsibility. You can't say, oh, it's time for me to go. I mean, I know nurses that it's like 10 minutes after, my God, if that other nurse is not there, they're having a fit. As a supervisor, you can't be like that. So you got to make sure you on board, not on board, but let that next supervisor. Now, let's say you work 3 to 11 and there is no 11 to 7 supervisor, then you still have to let the nurses know what's going on. Whoever is going to be in the building needs to know. So make sure you share information. Don't keep things to yourself. If something happened to a patient, if you have an issue with a family member, somebody had a fall or whatever, make sure you pass it on. Share the love, share the knowledge. Don't keep it up to yourself. Okay. This is what, because these places are 24-hour care. There is no, it stops here, it stops there. No, it's like I'm going to continue on. It's continuing. Okay. I hope that was helpful to you. Um, I am finally going to have some time coming next week to really focus on finishing up that class, putting it online so that you guys can just do self modules at your pace. There's some exercises, you can do them, and you're going to have access for a lifetime so you can continually improve yourself. And it's not that hard a job. It really isn't, as long as you understand what your responsibilities are and you embrace those responsibilities. You're not resentful, you're comfortable in your own skin. That's the key. You exude confidence, and that's important. If you exude it, that means you got it. You can't fake that. And people know. The patients notice, your staff notice. Okay? So be kind to yourself. Keep learning, keep growing, keep striving. Thank you so much. Au revoir. À la prochaine.